Hello guys, my name is Tessa. I'm a licensed esthetician and acne and nutrition expert. I wanted to come on and make a video because I feel like I hear the same story over and over from new clients who feel like they have tried everything and they feel so hopeless and lost. And I know acne and struggling with your skin takes a mental toll, it takes a physical toll, it makes you not want to socialize, makes you not feel like you can be your best, most outgoing self. A lot of acne sufferers tend to isolate and their quality of life diminishes because of that. If this is you, if you're struggling, if you feel like you are at rock bottom, I want to kind of enlighten you and give you hope that there is an alternative method to this madness of just trying random products, adjusting one thing in your lifestyle, hope it works out. I have a different way of coaching clients one-on-one, and through this method I am able to not only look at the lifestyle and take a bird's eye view of all of the products you're using on your skin every single day, laundry products, what you're eating, the skincare routine, the makeup, the hair care. I literally look at everything. But one of the most valuable things I do for my clients is something that has not been talked about enough, and I feel people have been misled when it comes to clearing their acne and clearing their skin, because we have been sold this myth that the healthy thing to do is use actives or exfoliate your skin 3 times a week, that we need to take these rest nights, and if you do too much that can worsen your acne. Now, this is the case with products in the past that have been harsh, and that certainly can affect your barrier. The goal is not to destroy the barrier, but what we have to realize with acne-prone skin is that it is producing 5 times the normal amount of skin cells in the follicle. And we have a lot of myths and ideas about where acne starts. We've heard, you have acne because you eat French fries, your diet is bad, or because you're dirty. These things are not the case, and while hygiene, bacteria, and food triggers can affect acne, it's so important to recognize acne for what it is. It is a disease of the follicle that involves retention hyperkeratosis. This means your follicle is producing way too many skin cells. We're producing millions of skin cells every single day, and you're shedding 5 times the normal amount in that pore. This naturally leads to a lot of buildup and requires the person who is acne prone to use active ingredients and exfoliating ingredients every single day. This is the best way to interrupt that acne process because that buildup is starting in the pore. Yes, we need to look at diet. Yes, we need to manage your stress. There's lots of lifestyle factors, even taking excess supplements, that can contribute to acne. However, I think we have this misconception that skincare products are fluffy and that's not going to get to the root of your acne, but we have to recognize, because acne starts in the follicle, it starts in the pore, when we are using active ingredients that actually target this process and remove that buildup of dead skin cells, bacteria, and oil, we actually can have success at getting the pore clear. And then once we've done that, the secret is maintaining it. So a lot of people think, oh, I just want to use acne products when I have acne. No, you need to recognize your skin is acneic. It's likely producing too many skin cells, and for that reason we need to always be treating your skin. We need to always be removing that buildup from the pore to keep you clear. When you look at my skin, it almost appears that my skin is poreless, and that is because I do a very good job at interrupting that acne process. Blackheads are the mildest form of acne, so I do not leave any blackhead untreated. I treat the whole face. I use my actives all over the face, not just as a spot treatment. If you're to this point and wondering, okay, but what products do you use on your skin? Which active ingredients are going to treat my acne? This is where it needs to be personalized. It is so important to have a professional treating your skin when you are acne prone. I know these days we want to self-diagnose, we want to do everything ourselves, we want to pick the skincare, but there is something to be said about working with a professional, working with an acne expert, and having an expert choose the right active ingredients for your acne type and your skin type, because every skin can respond differently to different ingredients. Another tricky component of treating acneic skin is making sure you are on an accelerated program. When you go to the dermatologist, typically they will give you one acne active. A lot of times they give people tretinoin, and this can be effective for some and not effective for others. We know retinoids successfully treat about 40% of acne patients, which is why you'll hear from some people, oh my gosh, tretinoin is the best thing ever, totally cleared my skin, whereas for others it can be not the right ingredient. And the other problem with this method of monotherapy, just recommending one treatment for the acne sufferer and not seeing them maybe for a year later, is that we need to be increasing the actives in an accelerated program. I talk about progressive overload for the skin a lot. This is a concept that I use to relate to people because I think we understand if you're trying to get stronger in the gym, you need to slowly increase either the strength of the weights or the reps, and that is how you build muscle and get stronger. It's similar with skin in that we cannot start guns blazing treating you with the highest percentage and strongest actives. We need to make sure we create a program that meets your skin where it is at and slowly increases the strength of the actives over time. You will also find with time, with the right active ingredients, these ingredients actually make your skin stronger, not weaker. If you were to ask me what my skin type was like 7 years ago, I would have told you, oh, I'm so sensitive, you know, I can't use much. It was just that my skin had never experienced progressive overload, so it was very weak and compromised. But over the years, using lots of active ingredients and even working up to using them at the higher strengths, you can see my skin doesn't appear red or sensitized. It actually looks quite glowy, and it has resilience and strength to it because I have slowly increased the actives I am using over time. One of the other most common mistakes I see is that if somebody does get professional help, such as a dermatologist or an esthetician, they stay on that program for way too long. It is so important, again, to work up to daily use of the product and at a certain point to increase the strength of the program so that your skin does not get too adjusted to it. We will need to continually adjust and increase the strengths of the actives until we find that threshold where we're thoroughly interrupting the acne process and removing as many dead skin cells as you need. All skin can require different levels of exfoliation, which is why it's important you work with a professional to find the level at which we are interrupting that acne process sufficiently. I have a very unique program in that I speak to my new clients for an hour. We talk about their lifestyle, I review all of their supplements, all of their household products, all their cosmetics, and I create a individualized program for each of them. And the important thing about this program is that it's not only tailored to your skin and has other ingredients that will support the actives, it is going to be an accelerated program that increases over time. I actually haven't seen other professionals doing this the way I do it, and I do find it's a very effective way to treat acne but also strengthen skin with time and make sure you get a beautiful glowing result. We want that compact stratum corneum, which means the pores are very flat and clean, and we want that thick dermis, that strong skin that is resilient, is less prone to aging and damage over time. When you have a thick dermis and you experience an acne breakout, it is more difficult to experience scarring because the skin is strong, it's robust, and it has the structure to heal from that acne trauma. I do not believe that there is one thing, whether it's changing one thing in your lifestyle or one product, that is going to completely clear your skin for good. It can happen, but it's not a good system to rely on. You really want to make sure you are taking a comprehensive look at the lifestyle and that you are also planning for the future. And that is what I do with my clients. I'm not just thinking about where their skin is at this moment. I'm creating a vision for where we want to be and a roadmap for how we can get there together with this method of accelerating the program over time using progressive overload with skincare. A good acne care program is going to be preventative versus reactive, and we want to make sure we are looking at the long-term vision for clearing your skin. You want help, if you want my support, if you want me to be there with you and walk you through this entire process, be the hand you can hold when you are going through low points or when you are confused, please allow me to help you and guide you. I would love to be your esthetician. I will put a link to my booking page where you can sign up and book your first appointment, which can be so life-changing. You will walk away with so much clarity about exactly what you need to do, how I recommend eating, products I recommend you use or don't use, and best of all, I'm going to give you a custom accelerated program that is designed to support your unique skin. I hope you guys enjoyed this video. I hope you learned something about acne, and I hope this gave you hope that you absolutely can clear your skin. You just need the right tools and guidance. I love you so much, and I hope to see you soon on FaceTime.